What results can you expect out of a non-surgical hair restoration? Well, it all comes down to picking the right person who should benefit from a non-surgical hair restoration versus a surgical one. If you watch the videos on what causes hair loss, how to pick between surgical and non-surgical, you'll see that we tend to pick people for non-surgical hair restoration who we feel have hairs that can be thickened. And we look for a criteria of the hairs being half the original thickness or more, meaning that the follicle is relatively active and the blood flow to that follicle is open enough that we think we can improve it and get it back to its full or near full thickness. Now, this always isn't the case that this is possible. If hair loss has been around for a while and the blood vessels are not dilatable with minoxidil, or we can't improve the follicular metabolism with ACS therapies, we do have failures. And it's uncommon, but in these cases, our office is built such that we can transfer the clinical fees of the physician, myself, over to a hair transplantation as our backup. So we like people to know, like, hey, you should try non-surgical hair restoration if it is all possible to restore your hairs, because it's the most natural means of doing so. And if it doesn't work, you can move on to a transplant situation to restore your hairs. Now, I will tell people who have hairs that are thinned out too far that they are not candidates for non-surgical hair transplantation. I will not offer them this program. I'll say you should just go straight to the transplant. However, in that case, if you want to try non-surgical, I'm not going to stop you. I think it's a great treatment, and sometimes we're very surprised. But what can you expect to see? If you're someone who has thinning, but you still have more hair in an area than you can see skin, then you can expect to see about a 50% improvement in that area. Now, if there's another area in your scalp where you can see more skin than hair, it's unlikely you're going to see an improvement because the blood vessels are thinned out too far. So it's really important to look across your scalp and say, hey, where do I have more hair coverage than skin exposure? In those cases, can I make those hairs better with non-surgical restoration? But in the areas where you have more skin than hair, really focus on your surgical options as the best way to restore your hairs and expend your resources.